If you are over 60, or you care about someone over 60, open the medicine cabinet. Look at every bottle. Pain pills, sleep aids, heartburn pills, cold medicine. Because one of them may be doing something you never connected. Not suddenly, not loudly, quietly. And here is the question most people never ask. Is this still helping me? Or is it slowly making something worse? Because after 60, the danger is not always a new disease. Sometimes it is an old pill nobody reviewed. Welcome back to Senior Health Research Host. I'm Alex. I'm not your doctor, and this video is not medical advice. My job here is different. I watch doctor videos, compare the claims, check the evidence, and help you understand what questions are worth asking your own doctor. And today's topic is one of the most important ones I've covered. 7 doctor warnings about pills that may hurt your heart, raise your blood pressure, increase fall risk, or quietly create dangerous combinations in older adults. Now, before we start, I need to be very clear. This video is not telling you to stop any medication. In fact, the American Heart Association specifically says not to stop prescribed medications without talking to your healthcare professional. So please, do not panic, do not throw pills away, and do not suddenly stop anything. Use this video as a checklist for a medication review. The real danger for many seniors is not one dramatic event. It is the quiet routine. A pill gets prescribed at 58. It gets refilled at 63, then again at 68. Then another doctor adds something else. Then an over-the-counter pill gets added for pain, reflux, allergies, or a cold. And suddenly, by 70, the medicine cabinet is not just a cabinet. It is a puzzle. And sometimes, nobody is looking at the whole puzzle. So let's go through the 7 warnings. Warning number 1. Common pain pills, especially NSAIDs like ibuprofen and naproxen. These are the pills many people trust because they are familiar. Back pain, ibuprofen. Knee pain, naproxen. Arthritis flare, another dose. And because they are available over the counter, many people think they are harmless. But this is where the first doctor warning comes in. The FDA has a safety communication stating that non-aspirin NSAIDs can increase the risk of heart attack or stroke. The FDA page specifically references the strengthened warning that these drugs can cause heart attacks or strokes. Now, this does not mean one occasional pill automatically causes a heart attack. That would be fear-mongering. But doctors warn that in older adults, especially people with high blood pressure, kidney issues, heart failure risk, or multiple medications, NSAIDs can become more complicated. The American Heart Association also lists non-steroidal anti-inflammatory drugs, including ibuprofen and naproxen sodium, among drugs and substances that can raise blood pressure. If you are over 60 and using ibuprofen or naproxen regularly, has your doctor reviewed how often you take it, your kidney function, your blood pressure, and your other heart medications? That is the real self-check. Not, is this pill evil, but is this still safe for me at my age with my current health? Warning number 2. Cold and sinus pills, especially decongestants. This one surprised me because many seniors do not think of cold medicine as heart medicine. But some cold and sinus products can affect the cardiovascular system. The American Heart Association says nasal decongestants can raise blood pressure or interfere with the effectiveness of medicines, and people with heart disease, high blood pressure, thyroid disease, or diabetes should ask a healthcare professional before taking them. This matters because a person might say, I only took a cold pill, but that cold pill may contain pseudoephedrine, phenylephrine, or another decongestant type ingredient. And if that person already has high blood pressure, atrial fibrillation, heart disease, or is taking blood pressure medication, that simple cold pill may not be so simple. This is exactly the type of warning that works well in your channel format, because Alex can say, I watched several doctor explanations and the pattern was the same. The problem is not the cold. The problem is the hidden ingredient inside the cold medicine. So the viewer's practical question becomes, before I take a cold or sinus pill, do I check the label for decongestants? Warning number 3, daily aspirin, especially when someone started it years ago just to prevent a first heart attack. This one needs nuance. Aspirin can be very important for some people, especially people who already had a heart attack, stroke, stent, or certain cardiovascular conditions. That is called secondary prevention, and it is a different conversation. But many older adults started daily low-dose aspirin years ago because they heard, it protects the heart. The U.S. Preventive Services Task Force recommends against initiating low-dose aspirin for primary prevention of cardiovascular disease in adults 60 years or older. The same recommendation explains that aspirin can reduce some cardiovascular events, but it also increases the risk of gastrointestinal bleeding, intracranial bleeding, and hemorrhagic stroke. Both cardiovascular risk and bleeding risk rise with age. This is not a stop aspirin today message. It is a check why you are taking it message. If you're taking aspirin because your cardiologist prescribed it after a heart event, that is one situation. But if you started it yourself years ago because you heard it was good for the heart, that is a medication review question. The self-check is, am I taking aspirin because my doctor still wants me on it? Or am I taking it because of old advice that may no longer apply to me? Warning number 4, steroid pills like prednisone and methylprednisolone. Many people use steroids for inflammation, asthma flares, arthritis, autoimmune problems, allergic reactions, or pain conditions. Sometimes they are necessary. Sometimes they are powerful and helpful. But they are also not casual pills. The American Heart Association lists systemic corticosteroids such as prednisone and methylprednisolone among drugs and substances that can raise blood pressure. Why does this matter for seniors? Because after 60, blood pressure, blood sugar, fluid retention, sleep, mood, and heart workload may already be more sensitive. A steroid that helped someone at 45 may feel very different at 72, especially if the person has hypertension, diabetes, kidney disease, or heart failure risk. The warning is not that steroids are always bad. The warning is that they are powerful, and powerful pills need a reason, a dose, a duration, and a review. Self-check. Am I taking this only for a short, supervised period, or has it become a repeated habit? Warning number 5. Heartburn pills, proton pump inhibitors, also called PPIs. These include medications like omeprazole, pantoprazole, esomeprazole, and similar acid-reducing drugs. For many people, they are helpful. For ulcers, reflux, esophagitis, or certain stomach conditions, doctors may prescribe them for good reasons. But doctor warning videos often focus on this question. Was it meant to be temporary, but became permanent? FDA approved labeling for pantoprazole notes that low magnesium has been reported rarely in patients treated with PP is for at least 3 months, in most cases after a year of therapy. Serious adverse events can include arrhythmias and seizures. This matters because magnesium is connected to muscle function, nerve function, and heart rhythm. Again, this does not mean every PPI user is in danger, but it does mean long-term use should be reviewed. On PPIs, the responsible doctors were not saying, never take them. They were saying, do you still need them at this dose every day for years? That is a much more credible angle. Have I asked my doctor whether I still need this heartburn pill daily, or whether there is a lower dose, shorter duration, or different strategy? Warning number 6. Sleep and anxiety pills, especially benzodiazepines. This one is not always described as a heart pill, but it matters deeply in older adults because the heart is not the only thing that determines survival. Balance, breathing, alertness, and falls matter too. AHRQ notes that the 2023 American Geriatric Society Beers criteria recommends avoiding benzodiazepine use among adults aged 65 or older, and also recommends avoiding concurrent benzodiazepine and opioid use in older adults at risk of delirium or with a history of falls and fractures. Johns Hopkins also lists benzodiazepines among drugs that can contribute to oversedation in adults over 60. Oversedation can cause drowsiness or confusion and raise the risk of accidents. Now here is the real-life part. A person says, I'm just taking something to sleep. But then they wake up at 2 a.m., feel groggy, walk to the bathroom, lose balance, fall, and break a hip. The pill did not attack the heart, but it may have started a chain reaction that threatens independence, mobility, and life expectancy. Sometimes the dangerous pill is not dangerous because of what it does in the bottle. It becomes dangerous because of what it does at 2 a.m. in a dark hallway when someone over 70 is half asleep. Self-check. Do I feel foggy, unsteady, confused, or more forgetful since starting this sleep or anxiety medication? And again, the safe line. Never stop these suddenly. Ask your doctor about a supervised plan. Warning number 7. The most dangerous pill may not be one pill. It may be the combination. This is called polypharmacy. Polypharmacy is often defined as using 5 or more medications at the same time. StatPearls/NCB. I notes that using 5 or more medications is common in older adults and is associated with risks such as falls, frailty, disability, and mortality. Johns Hopkins says that by age 60, many Americans take at least one prescription for a chronic condition, and regular use of multiple prescriptions may raise the risk of overmedication, especially in older people. It also says a prescription review with a doctor at least once a year can reduce unnecessary prescriptions and help avoid side effects and interactions. This is where the whole video comes together. 1 pill for blood pressure, 1 pill for cholesterol, 1 pill for pain, 1 pill for sleep, 1 pill for heartburn, 1 over-the-counter cold pill, 1 supplement from the internet. Each one might have a reason, but together they may create a new problem. Maybe the blood pressure pill causes dizziness. Then the person falls. Maybe the pain pill raises blood pressure. Then another pill is added. Maybe the sleep pill causes fogginess. Then the person thinks it is just aging. Maybe the heartburn pill lowers magnesium over time. Then the person feels palpitations or weakness. Maybe a decongestant raises blood pressure for a few days. Then a home reading looks scary, and nobody connects the dots. The goal is not fewer pills at all costs. The goal is the right pills for the right reasons at the right dose, reviewed at the right time. So here is the practical checklist I would give at the end. If you're over 60, write down every single thing you take, not just prescriptions. Include over-the-counter pain pills, sleep aids, cold medicines, heartburn pills, aspirin, supplements, vitamins, herbal products, and creams or patches if they contain active medicine. Then ask your doctor or pharmacist these 7 questions. Number 1, do I still need every medication on this list? Number 2, could any of these raise my blood pressure? Number 3, could any of these increase my risk of dizziness, falls, confusion, or fatigue? Number 4, are any of these interacting with each other? Number 5, am I taking aspirin for a clear medical reason or old prevention advice? Number 6, do I take NSAIDs like ibuprofen or naproxen too often? Number 7, can we do a medication review once a year? That is not fear. That is control. Because the scary thing is not medicine. Medicine saves lives every day. The scary thing is automatic medicine, the pill that was never reviewed, the dose that was never adjusted, the over-the-counter drug nobody knew you were taking, the side effect that everyone blamed on aging, the combination that nobody checked. So if you remember only one thing from this video, remember this. After 60, your medicine cabinet should not be a storage box. It should be a reviewed, updated, intentional plan. If this video helped you, subscribe to Senior Health Research Host. I'm Alex, and on this channel we don't just repeat doctor warnings. We compare them, question them, check the evidence, and turn them into practical questions you can bring to your own doctor. And before you leave, write this in the comments. How many different pills, supplements, or over-the-counter medicines are in your home right now? Not to judge, to start the conversation. Because sometimes protecting your heart begins with one simple act: opening the cabinet, reading the labels, and asking better questions.